Good evening, Gerald. My name is Aiden. So before we start, I'll be seeking your consent for these 4 things in ascending order: pre-participation screening, balance assessment, cardiorespiratory assessment, and then exercise prescription. So before the start of all these sessions, I will need to conduct an informed consent before testing. It is to inform you about the exercise test procedure, about the benefits, risk concerning the assessment, listing any alternatives to the assessment, and to gain your full informed consent. By conducting this informed consent, you must fully understand and be aware of that you are volunteering to participate. You have certain responsibilities as far as informing me any problems you may be experiencing. You are also free to withdraw from any participation at any point of time with no consequences, and you're also allowed to have a question and answer session. So back to the pre-participation screening, it involves a health questionnaire which I will guide you through, and is for me to check and identify whether you need to receive medical clearance before starting exercise or increasing volume or intensity of training. And it's also to check whether you have any clinically significant diseases, and if you need to be in a medically supervised exercise program, and whether you have any medical conditions requiring exclusion from exercise program until conditions are better controlled. Assuming that you have passed the pre-participation screening, we can proceed on to the balance assessment and also the cardiorespiratory assessment. Okay, so balance assessment will be the evaluation of your ability to keep your body's center of gravity within the base of support when you are maintaining a static position or performing voluntary movements or reacting to external disturbances. The cardiorespiratory assessment will be the evaluation of your body's ability to transport oxygen to the muscles during prolonged exercise and the ability of your muscles to absorb and use the oxygen. From these 2 assessments, I will be able to develop an effective exercise prescription for you to fit your training goals and help you achieve them. Throughout the sessions, I will be ensuring your safety at all times. There will be a time where I will need to do spotting. Spotting is basically when, for example, during the balance assessment, where you are required to balance on one foot, in the case where you lose balance, I'll be there to support you and prevent you from falling and getting injured. So that's basically spotting. Furthermore, for example, if you are unable to do a certain exercise, I will provide you with an alternative that you can work with. Then there are indications for terminations, where this can be on the test site itself, where, for example, you are unable to perform the test which you'll be terminated in. That is also where I can assess that you're not feeling well, where, for example, you look pale, then I'll have to stop the assessment and I will advise accordingly. For the fitness assessment, you need to follow specific guidelines: no alcohol, no caffeine, no food, no tobacco before the test. And if you had any of these 3 hours prior before the test, please let me know so I can make special arrangements for you. And also ensure that you have ample of rest. And if you're taking any medication, please let me know as well. So the whole purpose of this screening is to identify potential issues and ensure your safety. And if you have any specific medical conditions or concern, please also let me know. This will help me determine if you're ready to proceed with the assessment and exercises that will be conducted. If you have any questions, feel free to ask at all times. With that being said, do you have any questions before we begin?
No.
If not, I would like you to sign this form. Okay, now I will be checking for specific diseases. Do you have any known cardiovascular or metabolic or renal diseases?
No.
Okay. Okay, now I'll be checking if you have any signs and symptoms of underlying cardiovascular, metabolic, and renal diseases. Now I'll be showing you the signs and symptoms. Could you check if you have any?
No.
Okay, now I'll be checking how hard do you hope to exercise. Do you desire to exercise at a light, moderate, or vigorous intensity?
Moderate.
Moderate, okay. Now I'll be checking against the ACSM pre-participation screening algorithm. There are actually 2 charts, but since you have stated you exercise regularly 3 times a week, and you do not have any cardiovascular, metabolic, or renal diseases, and no signs and symptoms, medical clearance will not be necessary, and you will be able to continue your current exercise intensity and progress as appropriate.